Today, I will talk about management and homeopathy treatment of spinocerebellar ataxia. Spinocerebellar ataxia, certainly it is a neurological disorder and it is a group of inherited neurodegenerative disorders. It affects spinal cord and we know it causes progressive loss of muscle control and also coordination over time. In our clinic, we get symptoms like loss of coordination, medically which is called ataxia. Patient express difficulty walking or maintaining balance. Sometimes we get symptoms like tremors, involuntary shaking of hands or head occurred, slurred speech, slow speech. Dysarthria is also evident. Rarely we get abnormal eye movements, which is called nystagmus. In some cases, where age of the patient was more than 50, we get symptoms like difficulty with fine motor skills, such as problem in writing, buttoning and eating. And sometimes muscle stiffness or weakness is also prominent. A couple of months ago, I had gone through a patient. He expressed swallowing difficulties as well, which is called dysphagia. And I understood that because of his advanced stage, these kind of symptoms occurred. Now, if I talk about causes, actually genetic mutations are the main causes. Degeneration of the cerebellum and spinal cord occurs because of genetic mutations, which leading to loss of nerve cells and pathways controlling movement. Secondly, autosomal dominant inheritance. A single copy of the defective gene from the parent can also cause disorder. Rarely we get causes, etiological causes, mitochondrial or secondary causes. It is rare due to toxins, due to vitamin deficiency, especially vitamin E, or sometimes because of autoimmune factors. Before going to the homeopathy treatment, now I will talk about some management. Why management? Because management aims to slow progression, maintain independence and improve quality of life. We ask patients to perform physiotherapy. Why? To improve muscle strength, to improve balance and to improve mobility as well. Sometimes occupational therapy works well to assist with daily activities using some mechanical adaptive tools. Speech therapy may help in this disease for communication and swallowing issues. Sometimes psychological support and counseling is also required for emotional health and coping skills. Assistive devices are used as well, use of walkers, braces or wheelchairs when needed. Finally, to some patients, genetic counseling may be required. It is important for affected families before planning next children. Now, I will talk about homeopathy treatment for spinocerebellar ataxia. You know, homeopathy focuses on individualized and holistic management, aiming to improve coordination, aiming to improve muscle control and emotional well-being. While it cannot reverse genetic damage, it may help slow down progression, it may relieve symptoms and enhance nerve function. I have seen several patients in last couple of years. Commonly indicated homeopathic remedies are argentum nitricum, higher potency is preferred. When we see symptoms like loss of balance while walking, trembling of limbs, nerve anticipation, anxiety and unsteady gait, my chosen One of the polychrist medicine is phosphorus. I got brilliant result using phosphorus 1M when we got symptoms like weakness of the spinal cord, trembling and visual problems. Sometimes zinc metallicum moderate potency works well when we get symptoms like spinal degeneration with restlessness and trembling. Sometimes patient express jerking movements and nervous exhaustion. As a complementary medicine, I have used several times causticum 200 potency, where symptoms like gradual paralysis, muscular weakness, and stiffness were evident. It was also helpful in speech and swallowing difficulties. Finally, one more polychrist remedy, which is conium maculatum. Higher potency works well. I have prescribed for several patients when I got red line symptoms like progressive weakness, trembling, and dizziness, along with progressing ataxia. Before concluding, I want to let you know homeopathic management guidelines. This treatment must be individualized after detailed case analysis by a qualified homeopathic physician. Complementary approach with physiotherapy, meditation, and nutrition enhances result. Patient must have to avoid alcohol, smoking, and processed foods. I ask patients to regular follow-up every after 6 to 8 weeks. Thank you.